Hey, ReMar nurses, you know what time it is. It's Saturday, so it's time for our newest program. Yes, Saturday Night Live. It's an NCLEX study session for you. For you, if you are a nursing student, come on in. It's Saturday Night Live. We are studying NCLEX content. Yes, I told you guys that we are revving it up. You got to be here. The study session is Saturday night. What else is there to do but study with me for NCLEX? It's that time again. Hello. Where you from? Let me know where you're from. Hey, I'm in Ohio right now. I am thinking of warmer days. That's for sure. It is November and it's getting a little cold in Ohio. Where we at? Shout out to South Carolina. Shout out to Florida. My nurses all over. Welcome, international nurses. We love you here. It's Saturday night NCLEX study session. You've been waiting for this. I know you have been. As we have more people come on in, Sarasota, Florida. Oh, I can't wait to be there. New Jersey in the house. Yes. Come on in. All right. As more people come to this study session, hey, let me introduce what we have going on here. If you've never been here before, my name is, let me put it on, Philippines, I'm here for you. All right, my name is Regina Callion. I am the #1 NCLEX instructor on the planet. I have been called the NCLEX Godfather, the Moses of NCLEX, and I am here to help you. And I'm so happy that you're here if it's your first time, because we love to study and help nurses all over the planet pass NCLEX. And so we have a couple ways that we do that. But the most significant, I would say, and I've been doing this for a long time, but my newest program, the NCLEX VT, also known as the virtual trainer, listen, this is the all-in-one NCLEX review that you need, even if you're in nursing school, but the NCLEX review is specifically to help you to get that nursing license, all right? So we will be doing questions from this program. Again, this is our online program that houses our content, our lecture content, our homework, and our questions. So they will all be coming from this platform. Shout out to Robert in Pittsburgh, PA. Love to have you here, Robert. Hope you're interested in being a nurse and you're ready to take it to the next level, because that's what we do. Not this level, but the next level. Hey, I also have Sacramento, California. It's a little bit early there. New York as well. Dallas, Texas. Hi. Hello. We are studying on this Saturday night. Smyrna, Delaware. Okay. Fort Lauderdale. Love. Texas. Hey, that's right. You're not from Texas, but Texas wants you anyway. Here we go. All right. I want to tell you guys, there's a section in the VT called Before the Books Arrive. And in this section, this is what you will get studying right away. You will get studying in the Before the Books Arrive section right away. And people ask me all the time, do I have to do this section? Can I just jump into the NCLEX review? I wanted to spotlight again, the purpose of the Before the Books Arrive section in your virtual trainer is to immediately get you to start challenging yourself. It's also a great way for you to review the science fundamentals, the science of nursing that is, and also help you to prepare for critical thinking. Yeah, so it's a great review. Don't neglect it, all right? It's there. It's optional. Of course, I want you to get into your NCLEX review right away, but while you're waiting for your books to arrive, get in that Before the Books Arrive section, okay? Because the questions in there, I'm going to show you some questions from the Before the Books Arrive section, and you will see how they do help you really to get back into the groove of studying. Because Robert, if you're going to move from being a state trooper to a nurse, you have to really dig into your studying. All right. Ingrid, you're taking the test in 2 months. Perfect. My program is just 6 weeks. So if you've been studying with me, you'll be ready. Shout out Massachusetts in the house with me. Thank you guys for asking about my family. Baby Shiloh is doing just good. She's doing just good. All right, let's get into the questions for tonight. Phoenix, Arizona, I see you. All right. Question number 1. Again, this comes from the virtual trainer Before the Books Arrive section. And it says this: a nurse is caring for a client with optic 2 impairment. which nursing intervention would be most helpful to provide assistance to this client. All right. Okay, number 1, providing a magnifying glass for reading. 2, placing a Snellen chart in the room. 3, giving the client all instructions in writing. 4, teaching the client about a low sodium diet. Okay, so we have a client. What do they have? They have optic 2 impairment. Which nursing intervention is going to be most helpful in providing assistance? All right. Listen, these are the options. Number 1, are we going to provide that client a magnifying glass for reading? 2, providing a Snellen chart in the room. 3, giving the client all instructions in writing. 4, teaching the client about a low sodium diet. Here you guys go. Tell me what you think. Robert, don't be scared about the changes, okay? We're friendly here. NCLEX is not going to be changing so much that you won't understand it, all right? Stick with us. I'm going to show you how to get it all done. All right, I see a lot of the wrong answers posting right now. Can somebody please pick the right answer? This client has optic 2 impairment. What are we going to do? What are we going to do for this client? All right. Let's see. What are you guys thinking is the most helpful? It's Saturday night. If you're a nurse, your attention is required. All right. I'm here to help you guys. All right. The correct answer is number 1. You guys got it. I thought I could fool you. I thought I could trick you, but I couldn't. This client has vision impairment, and we need to provide assistance to this client. All right. So number 1, the correct answer, placing a magnifying glass for reading. This is going to be most helpful because the client is visually impaired. So instead of number 2, placing a Snellen chart in the room, is that going to be helpful to the client? No. That's going to be more helpful to the nurse, if anything. Giving the client all right instructions in writing. Well, if the client can't see it, then they're not going to be able to take it in, understand it. All right. 4, nobody picked 4, teaching the client about a low sodium diet. It's totally unrelated. So the correct answer is going to be number 1. You guys got that one too easy. Let's try a different one. This one, let me see where it comes from. This one, all these questions tonight come from the VT. This one actually comes from our fundamentals section. So in your virtual trainer, when you get it, you have different compartments. So you have before the books arrive, you have an NCLEX review, and then you also have a new section that I created called a fundamentals course, and it goes over the fundamentals of nursing. So there's so much for you to do in the NCLEX virtual trainer that I promise to keep you busy if you're interested in studying. So this question comes from the fundamentals course, and if you changed your answer, shame on you, because you guys know you're supposed to go with your first mind, okay? So let's go with our first mind here. And the question says this, it's Saturday Night Live. Hey, the nurse is caring for a 6-month-old client recently diagnosed with bacterial meningitis. Which of the following clinical signs would she expect to find? Is it number 1, presence of the Babinski sign? 2, increased appetite and thirst. 3, learning disabilities. 4, increased seizure activity. Okay, here we go. I'm going to just be quiet. I just want to see you put the answers up. All right. I'm not going to say anything else. All right. All right. We're studying. It's Saturday night. I got almost 600 nurses from all over the planet here. The biggest nursing study session, hands down. Shout out to you guys. You guys are about it if you're here. You made it live. You made it live. Come on in. Do me a favor. Share this video. Put your answer on the screen. Smash that share button. I'm trying to get to 1,000 nurses tonight. Help me get there, guys. Help me get there. All right. So we have a 6-month-old client. This question comes from the virtual trainer. Have you seen it in your virtual trainer? Do you have the virtual trainer? Let me know. So a 6-month-old client recently diagnosed with bacterial meningitis. What is going to be the sign of this condition? I see some 1s on the screen. I see some 4s on the screen. I'm not going to carry this one out. I had a lot to say about it, but Big Bob, Robert, thank you for coming. Here we go. The question answer is going to be 3, 2, 1. I'm going to show it now. No, definitely not that one. It is going to be number 4. It's going to be number 4, increased seizure activity. Did you get that one right? I saw somebody put, I think it's 4. I'm not sure. All right. It's either 1 or 4. So the challenging thing about this question is that there was an answer that was right as well, which is number 1, right? So the presence of a Babinski sign is normal at this client's age. However, what is not normal is the condition bacterial meningitis. So we're looking for the clinical sign that that upholds bacterial meningitis. All right, and that's going to be number 4. So it says bacterial meningitis is the most serious type of meningitis. Can somebody put on the screen for me the other meningitis? There's 2 types of meningitis. Does anybody know what the other meningitis is? You have a bacterial meningitis and you have what is the other one? That's what I want to know. All right. As you guys are putting that on the screen for me, I'm going to keep reading. The most common clinical signs in infants are nuchal rigidity. Of course, anytime you see nuchal rigidity, neck stiffness, you got to think meningitis. Increased seizure activity, because meningitis, it attacks the what? The meninges in the spinal column, in the brain, right? So you have increased seizure activity, hypothermia, decreased appetite, and vomiting. All right. Oh, hey, thank you so much. I see the answer. I asked the question. There are 2 types of meningitis that you want to know for NCLEX. Bacterial meningitis is one. The second one is viral. It's a virus. Viral meningitis. That is the second one. And so you want to make sure that for NCLEX, you know the difference between the 2. You also know the isolation that is required for the 2 as well. Okay. Yeah. All right. So here we go. The next question is going to be coming from the before the books arrive section. Let me see. Is that what I have here? All right. That's what I have. So says question number 3, when washing the hands, the nurse should apply the soap when? Is it number 1, before turning on the faucet? 2, before wetting the hands? 3, after removing gloves? 4, after the hands make contact with water? Shout out Daytona Beach in the house. Love it there. Thank you for coming. All right, we're talking about number 3. This comes from the before the books arrive section, and this is hand washing. Goodness, you need to know how to wash your hands if you're going to be taking care of sick patients. All right. And so we're talking about, when do you apply the soap to your hands? Not when do you apply the soap to your hands in your regular life, but in the perfect world of NCLEX. That's a whole nother story, right? So when should you put soap on your hands? Maria says 4. Denise just joining us. What do you think? Clarence Cordova says 4. Wondering if he's right. Not sure. Crystal Adams, looks like everybody's picking 4 here. Is the majority right? Is there another answer? Is there a better answer here? All right, I'm going to show it. You guys got it. Thank you so much for coming here again. I'm just so happy to see 700 people in the house on a Saturday night. What are you guys doing? Just studying? All right, the correct answer the correct answer. And remember, if you're getting these wrong, it's okay. The purpose of studying is to learn, right? If you knew everything, then you wouldn't be a student. You would be the master, right? And so you come here to just evaluate yourself. If you get something wrong here, thank God this isn't the real exam, and you have time to remediate yourself. So this is all about finding weak areas. And if you find that you don't really have a lot of weak areas, then guess what? You're ready to test, okay? So the correct answer is going to be, hey, is number 4. You guys got it. Good job. Yes. So after your hands make contact with water, all right, after turning on the faucet and wetting the hands, then that is when soap should be applied. Yep. And so the nurse, she rubs her hands, gets up a lather. Somebody says you can't get a lather with dry hands. You have to wet the hands. All right. And then, of course, when hand washing, the time that you should be hand washing, make a note of this, is if you don't know, is at least 20 seconds, okay? 20 seconds for your NCLEX exam. But let me tell you guys this. The before the books arrive section, it is very challenging, but I have put an answer key to the before the books arrive section. So if you're doing the section and you're like, these questions are hard, I don't know what the answer is, just give me the answer. You no longer have to contact Team ReMar. Please, in your virtual trainer, just go to your file vault, okay? Just go to your file vault and get the answers there, okay? Clarence says, studying while I'm working overtime to pay for nursing school. Congratulations. That's the grind. That is the grind. All right. Studying and working. All right. Okay. So again, the before the books arrive section has an answer key. Get in that section in your virtual trainer. Get to studying. Hey, also, did you know if you don't have the virtual trainer, you can get the comprehensive review right now by going to my website, remarnurse.com. Just go there anyway. Check out what I've been doing. Check it out. I got some good stuff in there. But this is the RN and the PN right now. The VT is 40% off and the price is $249. All right. And the goal is for you to get your license in 6 weeks. And so if you think about that, it's more than worth it. All right. All right, how about we keep studying? You know what? You guys are really grinding right now. I can tell that most of you guys that come here, you're serious about passing the NCLEX. And I read this thing on Instagram, and it said, pay the price today so you can pay any price tomorrow. And I thought that was just so cool. It was just such a cool idea. Like, yes, sacrifice today. Do what you have to do today, so tomorrow you could do whatever you want. You could do whatever you want. And so I think when we talk about investing in ourselves, we think like, oh man, if you look at this price, you might be like, oh man, $249, that's a lot of money, right? That's a lot of money. But really, it's not. If you think about the investment on the return of getting a nursing license, it's like, yeah, pay $249 today, and then tomorrow you get your license. You know, the idea, the mindset. You can pay whatever price you want. Like, you have the economy, you have the access. Oh, it's just such a good thing. I don't know I cannot even tell you how good it is on the other side. All right. Hey, also, guess what? Black Friday is coming. Black Friday is coming, but check this out. You need to sign up for it. All right, because we're going to be doing some really cool things for Black Friday. Would you recommend the VT if you test in 4 weeks? Absolutely. Absolutely. We've had people Mona says it's worth it. Mona, tell them your story. Tell them the VT is worth it. I got more questions coming up too for you guys. But just a small note on Black Friday. We're gonna be doing some really cool things for Black Friday. For the ReMar products, but you need to sign up for it now, because actually if you sign up for Black Friday now, you can get the Black Friday price early. You don't have to wait until Black Friday. So that's why I'm telling you guys, listen, go to my email list. If you go to remarnurse.com and you sign up for my email list, okay? What you'll get is my Black Friday workbook, because you guys know I do a Black Friday NCLEX review all day. So you're going to get that workbook. You're going to get the early discount to Black Friday, so you don't even actually have to wait for the date. And then also you're going to get the sample lecture of the virtual trainer. So you'll get a sample lecture of the virtual trainer. Okay. So you will get all of these things. All right. You'll get the early discount. And from what I'm hearing, it's like 20% off, a 20% off discount. All right. Before Black Friday, if you sign up. All right. So how do you sign up for it? Go to remarnurse.com and you will join my email list from that website. All right. And you will definitely get access to what is going to be happening during that special time. I love Black Friday. It's like all hands on deck. All right. So you'll get the information that you need to pass NCLEX, period. That's all. All right. If you've already passed NCLEX with ReMar, some of you guys have already been on and say, hey, I passed with ReMar. We have the party coming. So you need to join the party and you get the ReMar t-shirt, which I'm wearing right now. ReMar Nurse. All right. Exclusive hotness for the streets, the nursing streets, not the other streets, the nursing student streets. But you get the tee. And you go to remarnurse.com/party to join, okay? And we are talking about the NCLEX party that's coming up in a few days, and I'm so excited about it. All right, we have people who are joining, and I can't wait to see them. Okay, so now that the announcements are out of the way, here we go. What day is our Black Friday? Our Black Friday is the traditional Black Friday, so it will be the day after Thanksgiving, and I will be doing... I think my review for Black Friday is like 4 hours long. It is very long. It is very intensive. It's going to be great. We're going to cover so many topics. We're going to go over the quick facts book, I believe. I don't know. I have so much planned. You don't want to miss it. All right. Get in line because you don't want to miss it. Yes. ReMar streets. Absolutely. Okay. All right. You need the T if you're going to be repping ReMar streets. All right. Here we go. All right. Let's do another... Oh no, what did I do? All right, let's do another question. Here we go. All right. And I'll answer your other questions that I see at the end of this programming. All right. A nurse is caring for a client. This comes from the fundamentals in the VT. A nurse is caring for a client who has not eaten or drank in 3 days. All right. Which laboratory value is the priority for the nurse? All right, here we go. Number 1, the serum sodium level of 150. 2, serum potassium 4.3. 3, the serum zinc 1.0. 4, the serum albumin 4.0. All right, here we go. We're talking about a client who has not eaten or drank in 3 days. What do you care about as the nurse? What do you care about? Tons of answers on the screen. Do me a favor, share this video. There's only like 30 shares. There's 700 people almost on here. Share this video Saturday night. Your nursing friends, they might want to study with you. Let's go. All right. What are we talking about? You got to know your laboratory values. I mean, if you get this question wrong, this is a very fundamental, this is a fundamental concept for nursing. So if you get this one wrong, you definitely want to get in the virtual trainer and review the fundamentals for sure. All right, I see the answers on the screen. All right, Maria, okay, I think you got it. All right. So we know our laboratory values, right? We know our labs. What are we most concerned about? All right. The correct answer, 3, 2, 1, is going to be, yes, that's serum sodium level. Great job if you got that one. Great job. You should be able to look at it. The zinc and the albumin, some people probably were like, oh, I don't quite know if I know those. But number 1 is definitely out of line, and this indicates dehydration. When the sodium level is too high, dehydration, right? Dehydration. So there are the numbers for the other laboratory values. If you did not know them, make a quick note of it so that you can make a flashcard or go back and study it or write it down in your quick facts book, just so you have it, all right? Let me ask this question since we're talking about fundamental reviews. What are the most common causes of dehydration that are tested on NCLEX? What do you say? What are the most common causes of dehydration that are tested on NCLEX? Keisha says, yay, the VT trainer is the bomb.com. Thank you very much. We worked so hard on the virtual trainer. We really did. We worked so hard. Shiloh is doing so good. Shiloh Jean is doing good. I'm here Saturday night, here to answer your NCLEX questions. The #1 NCLEX instructor on the planet. I'm looking for feedback right now, okay? What are the most common causes of dehydration? Just tell me that. What is the cause of dehydration? Tell me that one. All right, I'm here with you guys. Woo. All right. Vomiting. Yes, I'll take vomiting. What else? What else? What is another cause of dehydration that would cause the sodium level to go up? Vomiting is one. What else is like losing a lot of fluid? How else do you lose a ton of fluid? All right. Insufficient fluid intake. Oh, yes, that's dehydration. All right. Yeah. Vomiting and diarrhea. Yes, Marcella. There's some others that I'm looking at. There's some others that I'm thinking of. All right. Yes, you guys. Good job. Yes, I see it. I think I saw everything that I put on my list. I'm going to show you guys what I put down to make sure that you study them. But I think you guys put them all down. You guys got it. Yes. What are the most common causes of dehydration that are tested on NCLEX? Vomiting, diarrhea, yes, diabetes. Awesome. All right. So you guys got your thinking brains on, even though it's late. Some of you guys must be, you know what I think? I think everybody on here tonight should be a night shift nurse because it's late at night and you guys are up studying. Your mind is clear. You're focused. You should be a night shift nurse. All right. All right. Here we go. Some people are like, nah, I don't want that. I don't want that life. All right. So the most common causes of dehydration that are tested on NCLEX, and you have to know every one of these: diarrhea, vomiting, diabetes mellitus. All right. Diabetes insipidus and influenza. All right. So make sure if you don't know, now you know. Especially if you're taking NCLEX soon. All right. Here we go. We are studying NCLEX. I think we got a couple more questions. Let me see. All right. We're doing NCLEX questions. We're getting into it. If you're just joining us, we have been studying for some time now. This is Saturday Night Live NCLEX version. All right. Next question is this. It comes from the NCLEX review course. It's an interesting scenario. A nurse is scheduled to administer an antibiotic to a client who reports being allergic to antibiotics. Which is the initial action of the nurse? #1, ask the client if they have ever taken the prescribed medication. 2, question the client about allergies to other medications. 3, request an order for diphenhydramine. 4, request to give a smaller dose of the medication. Here we go. This is not select all that apply. This is just which is the first action of this nurse. What do you guys think? Come on in. This is Saturday Night Live. I want you to sign up for our Black Friday review. Go to remarnurse.com and sign up so you can get the workbook, get the early discount, get the promotions, get all the good ReMar information. I'm so excited that you guys are here. 750 nurses. Who would have thought? Who would have thought? This many of you guys were at home doing nothing, apparently, right? All right. So the correct answer here for this question, this is a very interesting scenario because we have a client who is about to get an antibiotic, and we know that they are allergic to antibiotics. All right. Did you see this in the VT? If you saw it in the VT, don't put the answer down. All right. All right. The correct answer here, Regina Gray says, is #1. The correct answer here is #1. You guys got it. What? You guys got it. Shout out Clarence, studying hard, working. as a police officer trying to pay for night school. Welcome. All right. So ask the client if they have ever taken the prescribed medication. Exactly. That's what we need to know. We don't want to know about other medications like number 2. All right. The nurse needs to assess whether the client is truly allergic to this medication, whatever medication she's scheduled to give. That is the priority. So the nurse should absolutely figure out that first. All right. Request an order for Benadryl, diphenhydramine. You guys remember about Benadryl. Benadryl for NCLEX. Let me tell you guys this. Benadryl for NCLEX is not the remedy for allergic reactions. It's epinephrine. All right. Benadryl works in real life, but for NCLEX, it's going to be epinephrine. All right. Did you get that one? It's okay if you're getting them wrong. Remember what I said. It's okay to get things wrong. My son, he watches Daniel Tiger. I don't know if you guys know who Daniel Tiger is. Some of you guys may or not know, but Daniel Tiger says this. It's okay. In the wise words of Daniel Tiger, it's okay to make mistakes, try to fix them, and do better too. All right. So we're studying Daniel Tiger's neighborhood. Shout out for the wise words. 4 says request to give a smaller dose of the medication. That is not going to be it as well. It's definitely number 1. All right. Definitely number 1. Let's do another question. You guys like these questions, huh? Let's keep it going. All right. Oh, this is good. This is good. All right. Which of the following assessment findings characterize thyroid storm? You guys know thyroid storm? Here we go. Which one? Number 1, increased body temperature, decreased pulse, and increased blood pressure. 2, increased body temperature, increased pulse, and increased blood pressure. 3, increased body temperature, decreased pulse, decreased blood pressure. Or 4, increased body temperature, increased pulse, decreased blood pressure. Whew. If you don't know what thyroid storm is, this question is going to be very difficult. All right. This question is going to be very difficult. That's why it's all about the content. It's not about the questions. It doesn't matter how many questions you do. You do 100 questions a day. You do 75 questions a day. If you don't know about the subject, you're wasting your time. You're wasting everybody's time. You're wasting everybody's time. You're wasting your time. You're wasting NCLEX time. You're wasting your kids' time. You could be playing with them. You could be doing other things. If you don't study the content first, that's why I tell you guys, get in the virtual trainer before buying a question bank. And even if it's my question bank, get in the virtual trainer first and go over this content. Yes, because you got to know about thyroid storm. You got to know about hyperthyroidism. So if you get this question wrong, it's simply a matter of not knowing the content, period. Okay. All right. The correct answer here is going to be number 2. Everything goes up. Yes, everything is up with thyroid storm. So the temperature, going to have a fever, going to be tachycardic, going to have hypertension. All right, this is a sympathetic nervous system response. Remember, I went over parasympathetic, sympathetic when we did our pharmacology review. I hope you saw it. I hope you saw it. And so what is going to happen is all of the vital signs will be increased. And this is a basic question of a response to a disease process, an emergency situation. And so you guys know that for NCLEX, the management of care, whether you're taking RN or PN, specifically RN, you definitely have to know abnormal responses because you're in charge of making that assessment determination. All right. So you're in charge of anticipating what's going to happen to your patient once they get their thyroid removed, the parathyroids. Were they accidentally removed? I don't know. All right. But you as the nurse have to relay very important information to the physician. All right. So if you got that one wrong, you need to brush up on thyroid care, okay? Thyroid management. Let's do another question. And then I promise I won't keep you guys long. I kept you guys long already. All right. But I won't keep you guys long. Here we go. This is from the NCLEX review course. Did you see this in the virtual trainer? This question says, a nurse is caring for a Muslim client who observes the prayer of Salat. It also can be Salah. The nurse encounters the client chanting. Which of the following is the most appropriate nursing intervention? Number 1. Okay. Return after the prayer and ask for a schedule. 2. Return after the prayer and administer all treatments. 3. Interrupt the client and administer the treatments. 4. Asked if the client would like privacy. Whew. This is a good one. Cultural competence. You gotta know this. Our question bank has a lot of cultural competence questions in there. Yes, the NCLEX virtual trainer is good for the RN. It's good for the registered nurse. It's good for the practical nurse. It's good for every nurse. It's good for every nurse because there's so much content that you need to know, whether you're taking the NCLEX or you're practicing. A lot of this stuff, you would be surprised. A lot of this stuff practicing nurses don't know. And so all of my ReMar nurses, hey, you have a responsibility to be excellent in your content knowledge, okay? I'm not doing this just for the sake of doing it. I want you guys to be great nurses. So what is going to be the correct answer here? Cultural competence. Sharing is caring. Sharing is caring. I dropped my water bottle. That was that sound. Here we go. I'm looking for what would you do? What would you do? Shout out Philippines in the house. I guess it's the morning there, huh? Annette says, I'm stuck between 2 as my first choice, but also thinking 1. This is tricky. This is very tricky. And that's what makes NCLEX so difficult, because you don't want to do the wrong thing. You don't want to get it wrong because then you fall below. Listen, when you get it wrong, you fall below the passing standard. And cultural competence is one of those newest topics that they really focus on because the community in America is so diverse. Yay, 800 nurses studying together. Isn't that awesome? Isn't that awesome? So cultural competence, you cannot neglect this. You cannot neglect this, all right? All right, so here we go. A lot of 1s, a lot of 2s. The correct answer, I'm going to show it to you. Let's do our countdown. 3, 2, 1. It is number 1. Yes, yes, yes. Let me see if I can change this. All right. So the nurse should leave the room without disturbing the client if they are in a ritual prayer. Okay. The prayer of Salat is usually done 5 times per day. All right. So it is most important for the nurse to ask for a schedule. All right. Ask for a schedule, because guess what comes first in the NCLEX world? This client's religious practices come before your care. All right. So as nurses, sometimes we get this like, you know, we think like, oh, I got to deliver this medication because I have a schedule to keep. And this is important for me to do. But for NCLEX, no. The client's cultural preferences, the client's spirituality is more important than that Tylenol that you came to administer. All right. And so what needs to happen is you need to be able to get creative and schedule all your nursing care around that client. So if you got that one right, shout out to you, because cultural competence is not something that is reviewed normally in nursing school to a great degree. I had 1 class on cultural competence, and let me tell you, it was not culturally competent for me. All right. So for the exam, they want you to be, let's look at the other question. Let's look at the other responses, why they're wrong. Let's just do that. So number 2 is close. A lot of people did pick number 2, but it says this. There's a word in there that I don't like. What is the word in number 2 that makes it wrong. And if you see this word, usually if you see this word in a sentence for NCLEX, you can think like, oh yeah, this might be wrong. I shouldn't pick this because it's that one word in there. Come on, what's the word? I'm looking for the word. First person that writes it down gets a shout out. All right, what's the word in number 2 that makes it wrong? Does anybody know? All right, I don't see it yet. It says, return after the prayer and administer all treatments. What word is wrong in there? Because we definitely know that we should return after the prayer. But what is the word that is there? Yes, Diane Goodwin. It says administer all treatments. We're not going to do that. We're not going to do that. All right. Yes, Darlene, Shay, Clarence, Diane. All right. Carmiel, is that how you say it? All right. All right. Yeah. Administering all treatments means any treatment that the client has scheduled for today, you're going to give when you come back. So you're just so like, I don't want this to happen to me again. I'm going to do everything. So, you can't do that for the client. It's not going to be good. You won't get your license. It's going to be a red flag. Like, this nurse doesn't know how to manage her care. All right. 3 says interrupt the client and administer the treatments. Goodness, no, we don't want to do that. We definitely don't want to do that. All right. And then 4 asked if the client would like privacy. Well, that's just another way of doing 3. You're interrupting the client. If somebody's praying and I say, excuse me, would you like some privacy right now? What have I done? I've literally taken their attention off of God and put it on myself, right? And do you think that's a good thing for NCLEX? No, we definitely don't want to do that. So it leaves us with one choice. And the only one that makes sense is number 1. Okay, is number 1. And so that's asking for a schedule. Hey, guys, guess what? If you love practicing NCLEX questions like these, check out my NCLEX virtual trainer question bank. Yep. It starts at just $29. Love it, love it, love it. And it includes 1,200 practice questions, and it also includes an assessment, an 100-question assessment. So if you like questions like that, the cultural competence, there's a whole section in my VTQ bank of cultural competence questions, and they are super tough, all right, because I go over the Muslim client, the Catholic client, the Adventist client, clients that are atheists. So it is a great way for you to get more cultural competence questions. Check it out if you haven't heard about it. ReMarNurse.com. Yes, Juanita, it's just common decency not to interrupt somebody. All right. And yes, that's all to it. That's all I have to say about that. All right. So also NCLEX VT question bank. You can do it on your phone. You can do it on the computer. Shanita says, I love the question bank. Thank you so much. All right. Thank you so much for that. Okay, so this is all coming from the virtual trainer right now. It's comprehensive review, NCLEX VT. I hope you liked it. Tonight was like a preview. If you never heard of the VT before, this is kind of what you get. You get me, you get questions, you get content. Don't forget, Black Friday is coming, guys. I can't tell you enough. Please, please, please go to ReMarNurse.com. Get off of this live. Go to ReMarNurse.com. Make sure you sign up because Black Friday is coming and you get the workbook. You got to have the workbook to do my review. All right. There's going to be so much stuff going on. Also, you get the early discount, 20% off. All right. And you get the sample lecture of the virtual trainer. Again, the virtual trainer is my, let me see if I can do something here. The virtual trainer is my review that I created, and it's the comprehensive review. So in it, you get the VT workbook and you get quick facts for NCLEX, all right? So people mention these books, so I just want to show them. And remember, the 5-star quick facts is the one that is the newest version of this edition. All right. How to do the question bank on the phone is simple. You just go to the website. If you order the question bank, you can just go to your phone website in like Chrome or Safari and pull up the website, log in that way. Finish the VT. Keisha says, I finished the VT and we'll start the question bank tomorrow. Perfect. All right. Team ReMar will be on hand Monday. Remember, Team ReMar is not in office. We're all working from home because of COVID, but they are on staff Monday through Friday, 8:30 to 5. All right. Shiloh Jean. I don't know if she's going to make an appearance tonight or not. What else? Let me answer your questions right now. I'm on for a couple more minutes. You should have BT 30 days, 60 days, 120 days of staying instead of paying monthly. Well, you can. Let me see. 30 days. You can get a 30-day subscription to the VT, the question bank. Well, the initial subscription for the virtual trainer is 3 months. So you do get a 30-day subscription. I mean, you do get a 90-day subscription in the first. But remember, my goal for the virtual trainer is for you guys to get your license as quickly as possible. So the program is 6 weeks. I want you to get your license in 6 weeks. I didn't intend for you guys to spend like months and months in the virtual trainer. I really wanted to motivate you to get in and get out. Okay. All right. What else? Hi, I'm late. What's on sale tonight? All right. So what I was talking about tonight is that Black Friday is coming up. You guys know Black Friday. All right. And so I wanted you guys to sign up at remarnurse.com for all the goodies that we will be giving out during that time. All right. So get on over there if you just came on. Do I need the VT or is DVD self-study good enough? I don't know. Let me say this about the DVD program. So I did need to do the DVD program again. I needed to re-record it because I hadn't done those videos since 2016, I believe I recorded those videos. And with the virtual trainer, what I wanted you guys to have was more accountability to yourself. And so with the DVD program, if you're still studying with it, I haven't sold the DVDs in over a year now. So if you're still studying with the DVDs, then you might want to explore getting the virtual trainer for more accountability, for updated information. And, there may be a reason why you haven't tested. I don't know. Let me know. But I think the virtual trainer is absolutely superior to the DVD program. Content is good. Content is great, but with the homework and the accountability, I think you might find yourself doing better. Okay. Where can I download the fundamentals workbook, or do I have to purchase it? So we don't have a workbook for the fundamentals course in the virtual trainer. The reason why is because the fundamentals course was something that I had did specifically for institutions. So I created that just for nursing schools, but I said, hey, let's give the ReMar nurses in the VT something extra. And so I put that course in the virtual trainer for you guys. So there is not a workbook for it, but I hope you guys can listen to it, take your own notes, and really learn from it. All right. How do I find the answer questions, the answer key in the VT? File Vault. So before the books arrive, go to your File Vault section in your virtual trainer, and you can get the questions too before the books arrive. Also, check out what else is in your File Vault, because there's practice NCLEX questions, there's updates, the study calendar is there. If you have not been to your File Vault in your virtual trainer, then you need to do so, okay? Somebody says, oh my goodness, I'm late. Yes, you're late. Are the DVDs still available? Clarence, they are not available anymore. We have not sold them for over a year now. And the reason why is because the virtual trainer is just superior to the DVD program. Okay. But you got to take that thing. All right. What else? Let's see. For Black Friday sign up. Oh, for Black Friday sign up, just go to remarnurse.com. Let me show you. Just go to the regular website, remarnurse.com. All right. Yes. Can I reschedule for the virtual trainer without buying the whole package? Can I resubscribe? Oh, yes. Okay. Yes, you can. If you have the virtual trainer and your virtual trainer expired, the 90 days passed, whatever have you, you just contact me at support.com and support@remarreview.com, and Team ReMar will send you a link. Okay. They'll send you a link to resubscribe. if you already have the virtual trainer, how do we get the workbook for Black Friday? Cool, no problem. Just go to the website, remarnurse.com, sign up on the mailing list, and that will put you in our Black Friday notification campaign, and you'll get that workbook. You're going to download that workbook. All right. All right. Velma says, do the VT. It is great, and it has more updates. Perfect. Reagan, I passed my NCLEX on September 26th using ReMar, but I still love studying with Regina. You're awesome. Thank you. Mona, I love the accountability. Yes. Randy says, yes, I have. So I haven't tested because I only have the DVD self-study program. Thank you. Get the VT, Randy. Black Friday is coming up, and I think you'll really like the experience. Kiki says, I have the DVD and the VT. Well, look at you. All right. Let's see. Thank you for the fundamentals. Tried to sign up for Black Friday, but didn't see a link yet. Well, no, it's not going to be a specific link for Black Friday. It's going to say, hey, what will it say? Join my list. It will just say join my list. And that's how you will sign up for it. I think we're going to go to it and I can show you. Regina, I brought the VT, the quick facts, and the DVD, but I need the assessment. Okay, so the assessment that I was talking about is in the question bank. Do you have the question bank, the VT question bank? That's where you will get the 100 question assessment. Okay. I have 12 weeks left at LPN school. When should I purchase VT? Okay, so you have just a few more months left. Congratulations. I would say get the virtual trainer when you can devote time studying, because you don't want to get something that you cannot do. That's not the purpose of the VT. And even though you get 3 months access to the virtual trainer, okay? And again, this is what your virtual trainer, this is what your a virtual trainer will look like, whether you get the RN or the PN. You're going to get the getting started, the before the books arrive, and then your actual NCLEX review. These things take time to do. So if you're in nursing school right now, and it's just the final months, you're going to be very busy with nursing school. If you have a break or you feel like you have extra time to study, knowing this information will help you do very well on your final exams, okay? Because with the virtual trainer, you're going to get a whole wealth of information. These are just some of the topics that this student has done, but look how much more there's still left to do. So when I tell you it's a comprehensive review, the student has not started these things, all right? And the VT will let you know what you completed, and it will let you go back. But like, again, there's quizzes, there's homework, there's assessments, all right? So this is something that you need to absolutely have time to devote to. And also, it's to prepare you, all right? It's to prepare you for your license exam. Very, very important, guys. Very important for you to do that. All right. What's the difference between the quick facts, the original quick facts, and the 5-star? I have the original quick facts. Okay, so the 5-star just has a couple new features in it. It has about 19 new topics. And it also has the calendar, the pharmacology section, and the clinical skills section. So those things you still have to be responsible for knowing if you don't get them in the 5-star quick facts. Okay. All right, let's see. I ordered the VT previously. I have the books. What would I need to do? Let me know what you mean specifically, because I'm not sure what you mean by what would I need to do. Okay. Velma, thank you so much. All right. I am having difficulty. That's not specific to me. All right. Which program do you recommend? Been out of the hospital since 2008. Okay, that's a while. Taking the PN in 2 months. Oh my goodness. If you're taking the PN in 2 months, all right. So this is a master account, so it has both. It has NCLEX RN and NCLEX PN. This has NCLEX PN. My NCLEX PN review, you need to get that, all right? If you have not been doing your content, and when you get the content, because you are studying in about 2 months, that's 8 weeks, go right to the NCLEX PN, all right? The NCLEX PN virtual trainer, go in there and get started, all right? As soon as your books come, go right into the virtual trainer for the NCLEX PN and get started. All right. And you'll be more prepared, absolutely more prepared with the exam. Somebody says, any chance a practice CAT exam with ReMar? You know, I'm working on some new things for you guys, and I am considering doing a computer adaptive exam. However, I am interested to see exactly what the changes will look like for the future exam. Because you guys know in 2022, 2023, they're going to be making some changes to the overall NCLEX. And I know it may seem like it's far away, but it's really not. And so I am prepping for those changes, and I may do a computer adaptive exam, but honestly, the majority of my students don't need to do a computer adaptive exam before passing the NCLEX. They can do the questions that I prepared, and they can focus on their content, and they'll do fine. All right. All right, let's see. One thing I don't like about the VT, you don't answer a question right, you can't move on. Yes, that's the one thing I absolutely love about the virtual trainer. So we are on opposite ends of the spectrum. There are many NCLEX reviews, and there are many reviews where you can get things wrong and you can just move on and progress. But for mine, it was very important for me to have accountability for you guys, even if I'm not there. So if you don't get something right on the virtual trainer, no, you cannot move on. And some people may not like this, but my rationale behind it is, what do you need to move on for if you don't know the last point? Like, if you don't understand this concept, I don't want to give you something extra that you may or may not comprehend. And so it's very important for there to be closure. Like, okay, you demonstrated that you knew this information, so now you can move on. But I know it's challenging if you're trying to really get through something. Like, if you want to hurry up and get through a program, then this probably isn't the program for you. But if you want that extra accountability and you want a challenge to your own self-evaluation, then this is a good program. Can I use the VT in 4 weeks? I test in 4 weeks. Yes, you can do the virtual trainer in 4 weeks for sure. Absolutely. All right, there's a study calendar. There is a study calendar, and you can modify it how you want to. Let me see if I can show you the study calendar for the virtual trainer when you get it. Oh, I got it. It's 11 o'clock. Oh my goodness. I didn't realize how late it was. Okay. It's in the file vault. Let me show you guys this. All right. So this is the main screen. Here's the file vault here. If you click on the file vault, it will open up the resources here for you guys. And if you go to NCLEX resources in your file vault, you have all of these files that you can download and print. And your study calendar for RN or PN week 1, 2, 3, 4, 5, 6 is all here. And so if you're trying to do this in 4 weeks or 3 weeks or 2 weeks, print out these calendars and then make them your own. Okay. All right. Okay. So that's what I want to say about that. How much is the VT question bank? Is $29. $29 to start. I see the VT is on special today. Will it be cheaper on Black Friday? Black Friday, you guys know the prices are phenomenal. But listen, if you sign up for my mailing list, you can get access to early discounts that way too. So you don't have to wait till Black Friday. All right. Okay. All right, guys. So it's 11 o'clock. We've been studying for a long time. I don't want to keep you guys. Saturday Night Live is supposed to be a fun, quick way for us to do our studying. I will definitely be back on again for Monday motivation. So check me out on Monday. Let me show you guys this one. Somebody said, how do I sign up for the party? So let me put that back up. The party is remarnurse.com/party. Okay. And that's how you can sign up for the NCLEX party and get information about the party. Okay. All right, guys. Thank you so much. Thank you guys so much. I hope you have all your motivation to study. I want to show you guys your girl, your home girl. This is my motivation to study. She's here with me. I wish she was sleeping, but she's not. You're not going to be sleeping for me right now. It's 11 o'clock. Shiloh is up. She's wide awake. Shiloh turned 1 month. She's 4 weeks now. Can you look at the people, please? She turned 4 weeks yesterday. And the girl is not sleeping through the night. Y'all should have told me. Y'all should have told me how to get the newborn. Y'all should have told me how to get the newborn stuff together, because we don't have our days and our nights together right now. And so 11 o'clock, this is Mrs. Party all the time. This is Mrs. Party all the time. Say hi to the ReMar nurses. Then she's looking around. She's like, where they at? Where they at? They're here. They came on to study with mommy. All right. So I'm out, guys. I have a long night ahead of me. No, this is team no sleep for real. Me and her together. All right. So thank you guys for studying with me tonight. Love you so much. All right. You guys did fantastic. And I will see you on Monday. I will see you guys on Monday. Let me see. Just looking. Let's see. Shiloh. Oh, yeah. Shiloh, she's representing ReMar, our baby line. So she has the ReMar onesie on. ReMar onesie. And she is growing so fast. Oh, my goodness. She's huge now. All right. Okay, guys. We are off. We are off. Shout out to all the moms out studying today. All right. Bye. Sign up for Black Friday. All right. See you later. Bye-bye.